What people don't realize is when we get pregnant, it's almost like our body wants to treat it like it's a foreign body, and you kind of go into an immune response. And if we have an already going on immune response in our mouth, then we're fighting 2 infections and our bodies are working overtime. All you really need is a little damp washcloth and to wipe those teeth, because you can put more pressure with your finger and not cause damage to the tissue than using a kid's toothbrush.
We've had many moms come in who, after we've been through therapy with their kids and done a release on the kids, they'll come back for their post-op appointments. Their kids are eating, they're not in pain anymore, they're talking. I mean, we have success stories every week.
Yeah, this is a tale, oh yeah, a tale of 2 hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of 2 hygienists.
Welcome back, everyone, to another episode of A Tale of 2 Hygienists, episode number 354. I am your host, Andrew Johnston, and thank you so much for making us a part of your day. So today we have a special 2-part episode on pregnancy, babies, and oral health. And we're going to come at it from 2 different points of view. So the first part was recorded at RDH Under One Roof with Melissa Calhoun, Jessica Atkinson, and Erika Flateau. Melissa also, if you remember, did the episode on embryology a little while back. And so then the second part of this, we invited Joy Lantz on, and she recorded in a way that we've never really recorded it before. It's almost kind of like the old radio shows where the guests call in. So we did that. And so it was a little bit different, a little bit weird, but I loved it. And to be fair to Joy, though, I didn't really give her too much of a chance to explain all the things that she does. She does a lot of speaking and coaching and lecturing, but this is kind of like a little bit of a teaser, let you know who she is. Make sure you do check out the show notes so you can go and find her and follow her. And hopefully you'll take one of her courses or see her lecture somewhere. And then next week, we'll be bringing you a show with one of my favorite people of all times, Katrice Apichka. And she's a relatively new favorite. Not that I didn't like her before, but we didn't really get to know each other until really this last year. And she's going to talk to us a little bit about HPV. But the way that she talks about it is, it's fun and it's engaging. It's just different, I think, than a lot of the other ways that we've heard it. Not to say that those ones are bad, but this one's just a little bit different. So you'll also need to look for her in the future, because I'm sure I'm going to have her come back and talk about vaping on a future episode at some point. Last week was ADA, and I want to give a huge and sincere shout out to Kate Davidowski. I hope that's right. Who was our point person for the podcast lounge. So the setup was amazing, everybody. I'm not sure if you had a chance to look on social media, but it was the most amazing setup. Kate was a great communicator. She made us feel welcomed and like we knew what we were doing. The main stage was outstanding. And that we had these high top tables that we were able to record from when we were on the main stage. You're going to hear some of those recordings a little bit later on in the year. But we had a round table and one with Dr. Pam. That was awesome. And I think the tip episode is going to come out this week that we recorded with Erika Flateau. So that one was going to be good. Just a quick plug, please make sure that you take a minute to rate and review the show. I would super appreciate it. If you review it and, say something about a particular episode that you liked, I would love that. Also in the future episodes, I'm going to have some updates for you all on the changes to the show, which last week I just told you there's not really any changes, and no, there's still not really going to be any changes, but we've been having calls about what new and creative things we might be doing. And I'm just really excited to share with you what we have planned with Endeavor Business Media. So thanks again for being here and enjoy this episode.
A tale of 2 hygienists.
Hey friends, quick pause in the show to remind you about the CE offered for several of our episodes. All you have to do is click into the show notes and follow the link to the CE Zoom website. Answer a few of those questions about the episode correctly and you'll be rewarded the appropriate amount of CEUs. This wouldn't be possible without a partnership with our friends at Tempstars. Tempstars is more than just a temp and a placement service. They are clinician-led and education-focused and strive to perfectly match individuals and dental offices. learn more about Tempstars.com, or go back and listen to some of their tip episodes. They are absolutely worth the listen. And now, back to the show.
All right, so the topic of today's episode is pregnancy.
And oral health, yeah.
Oh, and oral health.
Yeah. Well, I mean,
It is. Right.
it's what it is. So, yeah.
All right, well, Melissa, what should we know about this?
All right, just start.
Just
Just go with it.
I started 35 seconds ago.
Okay, all right. Well, how about I start with why this is so important to me. So I worked in pediatrics straight out of the gate in 2005 when I graduated from hygiene school. I'd worked as an assistant prior, and the office that I worked in Louisiana was a very, it was both private and Medicaid office. And on Fridays, I saw 2 to 5 year olds in the hospital, saw cases with the doctor. Sedation days, right?
Yep.
So I go to hygiene school, pumped, I'm going to change the world. And because that's what we all are here to do, right? And so I go over to Jacksonville, Florida, and I am working for a pediatric dentist there too. But this is a much more affluent practice, and I saw the same thing. So what are we doing wrong? That's my biggest, what are we doing wrong? And I truly believe it's because we're not getting the message out there sooner. So I started looking, and I think that we need to start with our moms.
Absolutely. I thought you were going to say the problem is goldfish crackers.
Well, it could be. Goldfish crackers could definitely be
and sippy cups with juice in them.
Sippy cups with juice in them, which have no nutritional value.
Right.
None. So juice is not really necessary. But that's a whole nother
We
podcast.
digress. let's get
a
back
whole
on
nother
track here.
Back to our moms.
Back to the moms. So I started really doing, when I went to grad school, that's what I really focused on. And my very first public health course was adverse birth outcomes and pregnant women. And the very first bit of research came out in 1996. I mean, to me, that seems like so long. 25 years ago, that first bit of research that came out that was like, hey, wait, like what's going on in your mouth may be affecting whether or not you have a preterm birth or a low birth weight baby. So I did my research on that, right? And in that research, I learned that there's not a lot of moms that actually go to the dentist. It's 60%, to be exact, of pregnant women suffer from gingivitis and early periodontitis. Like, that's a huge number. And in the last 6 months, the 2 pregnant women that I have seen, both of them suffer. One suffers from early periodontal disease, and the other is suffering with gingivitis that, she can't get under control. Which can't get under control because she's got these hormones in her body that are making all this go on. And what people don't realize is when we get pregnant, it's almost like our body wants to treat it like it's a foreign body. And you kind of go into an immune response. And if we have an already going on immune response in our mouth, then we're fighting 2 infections and our bodies are working overtime. And so when those hormones and, we can't get that infection under control in the mouth and the bleeding starts, the swelling of the tissue, then we start to get that back and forth into our bloodstream. We know that with all of these oral systemic links that we are finding, we know that that's how it all happens, right? So we just need to be more proactive about getting our female patients into the dentist to get, and our OBGYNs need to be, proactive in getting them in.
Yeah.
So, yeah.
That was going to be my question is, if you say you have somebody in your chair that's early periodontitis, more severe, what do? Do you get their permission and speak to their doctor, or how do you bridge that gap?
Why would it be any different than like if we have a, diabetes patient and they come in and they're like, well, I don't know what my A1C is, that 9 times out of 10, you should be calling their doctor to find out if, and having that open line of communication, sending a letter to the OBGYN and saying, hey, look, I've seen patient X and, she is in the early stages of periodontitis. Please be monitoring, the mom better. And, I'm going to put her on 3-month recalls until she has the baby, And the hardest part is the mothers that have socioeconomic issues. They aren't always getting the care that they need. And a lot of states have opened up to where Medicare Medicaid will pay for up to a year after, postpartum. So when those things start to happen more frequently, it will be a good thing.
So it sounds like maybe a miscommunication or a non-communication between your insurance company, your dentist or your dental health, and your medical health. I know in practices where I've worked, a lot of patients don't know that they have coverage when they're pregnant. They don't know that they can come in. Something that has happened for years and years is don't get x-rays when you're pregnant, and lots of people equate getting x-rays with going to the dentist, and they may be thinking, I'm doing a good thing here by avoiding the dentist, or I don't have money. They don't know that they have help with that. That's fascinating.
Yeah, and the things that we were taught 20 years ago in school, don't do anything until after the first trimester is over. Some of the research shows that having periodontal therapy is not going to reduce your risk of having preterm birth or low birth weight babies, but getting in prior to, there's some of the research isn't showing that like having the procedure done is going to change that risk factor because it's already in your body. It's already there, but it's very important that, our patients are seeing the dentist regularly, that x-rays are okay. Like if your patient's low caries risk, x-rays may not be necessary. But if you have a high-risk caries patient, it is imperative that you fix that decay prior to that baby being born, because if you don't, it's transferable. That bacteria can transfer to your child, and you are setting, that child up for a lifelong of dental caries. So that's the kind of scary part too. So it's important that we do that. And local anesthesia, all of that is safe too. There are options. There are options to have that done. Are safe. Right. You can use it with or without epinephrine, especially lidocaine. Lidocaine's, pretty much the safest.
What I'm hearing you say is it may not change the outcome when we treat you now.
Right.
But what it can change your patterns.
Correct.
We're going to start you on this type of treatment and start you on a pattern of seeing the dentist. So it might not change it for this baby, but what about the second, the third, the fourth baby?
And you almost start to think about the fact that, like, what about my mid-20s, college graduates, just got married? Like, being able to talk to those patients about, hey, like, when you decide that you want to start a family, just remember that if you have gingivitis now, it is important that you lower that and keep that plaque biofilm reduced. It's really important, just because we know our patients. We know when our patients get married. We know when our patients are going on vacation. I mean, we're
setting up those good habits now.
Setting up those good habits now is super important. So.
And back to the Medicaid question, are you finding dental provisions in there for moms that qualify?
Yes.
Okay.
So in certain states, not all of them, so make sure you check your states, but I know that in Maryland, when I was in Maryland, that they had extended to where it could be for up to like a year after. So keeping that good plaque biofilm, I think the biggest problem is finding a general dentist that is going to take Medicaid.
Right. To throw out another option for those pregnant patients out there, find a school.
Yes.
Because your fellow dental hygiene students are looking for a pregnant patient that will qualify for them to treat.
They are.
So
yeah, that's really important.
It's cost effective.
Yes. And a learning on all accounts for the patient, for the student, and it will help them in the future be better clinicians. Yeah. For those patients.
When you're educating your pregnant moms, and how do you go about talking to them about the transference of the bacteria once the baby's born?
Well, I let the patient know that those things can be transferred. So I make sure to tell them not to, suck on the pacifier when it hits the floor, because, it doesn't matter if we pick up the germs off the floor. We just don't want to give it to our babies.
Disgusting.
It's really gross. But
also, is that really going to take the germs
off?
No,
it's really not. But
it's adding.
This is written in the AAPD form because this happens.
Oh, absolutely.
No licking the pacifier, no eating after one another, using the same utensils, drinking after one another. And it's not just mom that can transfer it to the baby. It's their primary caregiver. Mm-hmm. So think about grandma.
Oh, yeah.
Who has high caries risk or who has periodontal issues, right?
Babysitter.
And she is smooching on that baby all day long, transferring that bacteria over. They're same thing. You got to look at that primary caregiver and who, in most daycares, they're not smooching all over them, but sometimes when you have that in home, you just like I don't know. I'm not saying when you hire your babysitter,
You're like,
make
"Listen."
sure you have a good oral health.
I'd like your dental records, please.
I'm going to need your dental records. When was your last x-ray set?
That would be on the first baby only. After that,
After that, no big deal, right? Like, look it away. But
yeah.
So that's, those are other things you have to be mindful of. So, but definitely like using the same utensils, drinking after one another. That's how we get those, and kissing on the face. That's the other thing. So, I think COVID has kind of helped with that. Like nobody really gets too close anymore, but maybe. I don't know. So.
I like how you said, Grandma, setting those boundaries with your close family can be difficult.
Oh.
And telling them that this is not a personal thing. I'm not just asking you not to kiss Baby Max, but I'm asking everyone to not kiss Baby Max on the face.
Let's not. Yeah, right. So, and that's I had a patient a couple weeks ago who 2 little boys, and the mom said, Dad's side of the family has a lot of oral health issues, and I'm so scared it's going to happen to my kid. And I'm like, what? And she said to me, I do not allow my mother-in-law to kiss my kids on the face. And I'm like, well, you're way above most people. Like you're
Brave woman.
like that you just, you told your mother-in-law no. Like, whoa, that's tough.
So what modalities do you, if you have a gal in your chair, say she's mid-20s and it's just really inflamed, what would you do in the chair for her as far as your treatment?
Well, our office is switching over to GBT therapy, which I am super stoked about. But I definitely disclose every single patient, and I show them how to keep that inflammation down. I'm a huge proponent of baking soda toothpaste because I really think that really breaks down that plaque biofilm. And so, it's those two things together, showing them, and that's the one thing for any patient, pregnant or not, showing patients where that plaque biofilm hangs out on their teeth is a game changer. And we learned it in school, but it's one of those things that
Goes out the window.
Out the window because we don't have time for that in our 40-minute appointment. But, you make time for that because it definitely
And you make time for the conversation.
Yes.
It's not a little bit of bleeding, a little bit of, you just have gingivitis because you're pregnant. It's not just band-aiding. It's saying, this is what's going on in your mouth. These are the potential things that we can do for you, or these are the risks that these present for you. Having that conversation.
And then making sure, like, even if it's gingivitis and not perio, getting them back on a more frequent schedule is really going to, reduce that. I mean,
Pull out that 43-46.
43-46, there you go. I mean, that's a great one, especially if there's, no bone loss, because it has to be no bone loss. Or else
You're right.
Just doesn't.
Then we're stage one.
Then we're stage one.
Right.
So that, those are things that I can do with them right then there. The other thing I tell patients that are expecting or trying to get pregnant, and, because you see those adults that are ready to have families, and they come in and one visit they're on a birth control pill and the next time they're not. And you're like, so are you trying to get pregnant? And they're like, yes. That's that great opportunity to start this conversation and be like, look, a lot of things happen. Pay attention to the signs in the mouth. If if you start to get that bleeding, if you start to get that, pay attention and get in here as soon as possible so we can reduce that.
The importance of updating your medical history.
Yes. Oh my gosh. Yes. Shameless plug for that one. Do your medical histories. It's very, very important. And that opens up conversations to have with the patients.
Well, and there isn't a mother out there that doesn't want to know one more thing she could do to keep her pregnancy healthy.
Well, and that's the thing.
Yeah.
That is pregnancy is such an opportune time for a woman to reinvent her, everything. But, having that good setup from the beginning is amazing.
Right.
So.
What I was getting at with that question was wondering how the response is when the mom finds out, this future mother, or maybe this is her second or third, but when usually you're probably talking to new moms, what's the response when they find out that their baby's at risk? And are they concerned? Are you finding yourself kind of comforting them? And
they just don't know, and no one is telling them. And I think it was 2017 in the state of Maryland, they sent out to every registered hygienist, dentist, this packet on pregnancy and how we need to be collaborating with the OBGYNs and talking, making sure that they know that it's important to ask their patients to get their checkups because of these risks. And I find that my patients have been very receptive and want to make as many changes. And like I had one, I think it was 2 weeks ago, that was, she came in and it was a slightly different person than I saw just 3 months ago, because she's focused on maintaining that good oral health so that it doesn't progress any further than where it is. And she's in that stage 1, but still, we don't want those pathogens to be passed on to that child.
I appreciate the efforts of your state getting information to the populations
Yes.
that are vulnerable.
I was very proud.
Yeah, in the state of Utah where I live, we did a segment called Baby Your Baby on our local news channel, where every year they talk about how to take care of yourself and your child during certain stages. And I had the opportunity to be on the news, which was terrifying, and because it's your face and your voice,
Not just
and
your voice.
not just my voice. And we talked about how x-rays are not the ultimate evil when you go to the dentist, and it's important to go to the dentist, and the fact that you're going to the dentist will have a positive effect on your children. So I think it's also a communication to those vulnerable populations. And I'm curious, there's mailing, news. Have you seen any other efforts made to this population?
No, I've only seen that. I've seen different, segments on the news and things like that. But health fairs. And I would like to get. I just moved to California 6 months ago, so I'm still trying to get my
Feet under you?
my feet under you there, or under me there, to figure out how to get into different places. But there were different programs through the health departments that would accept me to come in and talk to these new moms or pregnant women and things like that. So that was another way to get in there and do that, and just make sure that someone else other than their doctor telling them that this is important.
I love that. Health department. So
Yes.
if you're a hygienist listening that is has a passion for pregnant mothers, check out your health department.
Yes. See if there's availability for you to get in there to talk to the new moms.
Well, and then you speaking to the patient, gaining that permission, and speaking to their doctor or writing a letter or whatever you do, you're bringing awareness to the medical office, because they're seeing moms. This OB office is seeing moms day in and day out, and are they talking about taking care of their mouths? I'm sure most not.
Right.
Yeah.
Well, I also talk about infant care because it kind of goes together, right? But I was speaking to a pediatrician a couple weeks ago, and I asked her, I said, do you talk about oral health? She's like, yeah, I ask them if they go to the dentist. It's not really what I asked. Are you asking mom if they're brushing their children's teeth? Are they seeing a dentist? Because 12 months is when they should be seeing a dentist, if not before, depending on when that first tooth erupts.
Say it again. Say it again.
Anywhere between 6 and 12 months, get your babies to the dentist. It's super important. And even the dentist I work for right now, he's like, I'll look in the mouth, but you're the expert. I'm like, okay. I had a 2-year-old the other day. Kid was great, but he was like, yep, looks good.
Which is kind of problematic, though.
A little bit.
We had same situation. Mom came in. Hey, I was told I had to come in the moment that first tooth erupts, right? You can barely see just the incisal edge, right? Just that's all we could see. So we come in. They fill out, the forms for 10 minutes because it takes forever to fill out a health history. And then great. The baby's not really super cooperative, but we're going to take a look anyway. Doctor spends 2 seconds in there. Yep, that's a tooth that's erupting. Good job, Mom. Now, what are you doing at home? Oh, we just have a little cloth that we're using. Okay, great. All right, well, we'll see you guys next time. And so on our review form, the mom's like, what a complete waste of my time.
Right.
I didn't learn anything. The doctor spent 2 seconds with my child, and that's it. But really, what else?
Well, I'm glad you asked because the AAPD has an entire anticipatory guidance for children all the way up to age 18. We, as hygienists, should be discussing oral maxillofacial growth, how their mouth is growing. yeah, that tooth is coming in, and explaining to mom, that tooth is coming in. These are the next teeth that are probably going to come in. Then they're going to get another set of molars at 2. We need to be having that conversation with the parents. We also need to talk about nutrition, telling them that sippy cup is okay, regular cup is better, but water all day long. Like, they think that it's okay to just put milk in it all day long. Milk, breakfast, lunch, and dinner. Water the rest of the time. Juice, unnecessary. They don't know how great it is. It's not like you come out going, juice is awesome and it's full of sugar. Let's drink it up.
That's all I want.
That's all I want. No. And then, your non-nutritive habits. Are they pacifier suckers? Do they suck their thumb? Because good luck.
Yeah.
You can't cut that thing off.
Right.
Those type of things we really need to be discussing with them. Injury prevention is another one that no one ever talks about. Kids like to bite on things. Kids have bitten on cords and electrocuted themselves. Car seat safety, how important it is. Like, you're using the car seat properly. I know this sounds like it should be pediatrician, but it's all part of what the AAPD recommends that we be doing. So,
Myo munchies, something for them to chew on.
Yes.
Giving them alternatives. Yep. And I don't know a single mother that wouldn't like tips and tricks on what to do when their child is teething.
Oh, and that's a tough one because that's when my child ended up with a pacifier because she was chewing on it. But the rings are great that are cold. Put those in the freezer, cool them down. I've also heard and read about washcloths, wetting them and putting in, that way it's that cooling. Most of the products that are out now are different than from kids that were, 12 years old. The 12 years ago, they stopped putting benzocaine in everything.
Hallelujah.
Thank goodness. Yes. Don't worry, I'm not going to try to say big words for why we... Metahemoglobinemia. Got it. Boom.
Chocolate blood.
I've been studying that word. So they took benzocaine out. So there's products out there that are cooling that you can use a couple times a day, but really just give them something cold to bite on. That's the best advice, I've read.
And this conversation just took that 2 minutes and made it 5, 10, 15, giving the mother a reason to want to confide in you and trust in you as a medical provider. Like, I'm coming to you because you gave me things I can apply. You gave me a roadmap. You gave me peace of mind, direction.
Well, showing them different techniques, because every kid is different, right? I loved doing lap to lap or laying the kid down, my child in my lap and using a washcloth, or especially when they were little, a washcloth or, the little finger sleeve thing. Those things are great, but all you really need is a little damp washcloth and to wipe those teeth, because you can put more pressure with your finger and not cause damage to the tissue than using a kid's toothbrush, And then showing the parent that grain of rice, what that means. Another thing the AAPD says is a grain of rice or a smear layer of toothpaste as soon as that first tooth comes in. And
every commercial is telling them to do a
oh my goodness,
mashed potato amount of
a big old smiley face swirl.
Yeah.
And it's like, no, you don't need to do that. I literally touch the bristles to the top of the toothpaste. And some toothbrushes are out there that I really think are cool, that they have color-coded bristles where that's how much toothpaste you need to go on there. That's it. And I think that that's great. Those type of things are really beneficial for our moms. And then that patient has no longer been sitting there for 2 seconds in and out of the chair. It's an education appointment. And that's what I tell my parents. I'm like, look, it's not going to take very long to look in little Max's mouth. So I'm going to have a long conversation with you, talk to you about some things, ask you about your caries risk, because that's important too. Knowing the caregiver's oral care is really important, and their caries risk and
their oral history.
Their oral history, did you have braces? Because chances are, if you needed braces and Dad needed braces, Max is going to need braces.
Because he's sucking his thumb.
And he's sucking his thumb. So you're just, go ahead and start that that 529 for braces, not college. Sorry to all the orthodontists out there that are. And then you have spent quality time with that mom, that caregiver, and they are like, I learned so much. And now I feel like I can adequately take care of my baby's mouth. let's just hope they stick with it, right? So.
And where do you find this checklist?
It is on the American Academy of Pediatric Dentistry. They have a whole reference manual for everything.
Car seats included.
Car seats included. I mean, it really is. They have research on all these topics. So, and even the importance of mom's mouth and infant's mouth. So those things are really important.
Well, I know this conversation kind of transitioned, but your work in pediatrics is just so fascinating. Say mom comes in with a 2-year-old, I have a well. What do I do about fluoride?
So you have a well. Here's what I ask. Have you ever had your water tested?
Number one.
Because you have a well that hits an aquifer. That aquifer is the same aquifer that probably goes to the city water. Because there are areas that are flooded with fluoride, and you don't need to have any added fluoride. There's some areas that are really, really high, almost like you want to say don't drink the water. Yeah, so check your water. And if you, I believe, please don't quote me on that, I believe if you go to like your municipal water source, they will test it for you.
Yeah.
So I know that some dental offices will do it too. Like the office I worked at in Jacksonville, they would send it off and have it tested for you at one point. I don't know if they still do that.
Yeah, and the water has to be fresh when it's tested. So I don't know about the sending it off. I know, well, the municipal was wanted it within an hour. And don't leave it in the car. Don't
leave it in the because that changes because the plastic bottles will leak the BPA.
Right. And then they're like, your water's poison. Your water's poison. Don't drink your water.
Look, I think that's the perfect part to end on this one is poison in the water. So, Melissa, thank you again for being on.
Thank you again for having me. Oh, I love this. Oh,
love
well, thank
so
you.
much.
I definitely have a passion for this. But
well, if anyone has any more questions about this, you of our group probably are the experts. So, how can they reach you?
Well, they can reach me at Missy RDH on Instagram. They can DM me there, or they can email me at Calhoun, so MCALHOUN RDH at iCloud.com.
Thanks, buddy.
You're welcome.
A tale of two hygienists.
Everyone, welcome into this episode. I'm really excited because, one, we're using new technology, and no one might ever hear these words that I'm saying right this minute, which feels very kind of existential, but we're using a Bluetooth, and we have Joy Lantz on the phone. Oh, I feel like a radio show now. I have Joy Lantz on the phone. She's calling in. Call her. Hi. This is so the best. But I'm excited because this is a topic that I don't think that we've really ever covered. We've covered a little bit of myofunctional therapy. We've talked a little bit about the staging of, baby through toddlerhood, through childhood, through adolescence in various episodes in the past. But I think, Joy, what you bring is going to be just a little bit different of our perspective, and I'm very thankful that you're taking the time to pilot this with me. So thank you so much for being on.
Thanks for having me. I appreciate it.
So, Joy, if we could actually start, the listeners generally like to hear a little bit of a background of who they're listening to. So if you don't mind just kind of giving like a brief introduction about who you are, what you're doing, and why you're passionate about what you're doing.
Sure. So, a long road like all of us have. I've been in dental hygiene since 1998. I live in the South Chicagoland area. And, I was trudging along in my hygiene career and kind of getting a little burnt out, looking for something different. Probably 10 years ago, I started really looking into getting trained in myofunctional therapy. That was where I wanted to take my career. So I went and took a course. I got certified. And I did myofunctional therapy for a while, which it's great. I still practice myofunctional therapy, but I started seeing a lot of siblings coming. So, I'd be seeing an older kid and then their baby brother or sister would be with. And a lot of the things that you see going on with the older sibling, you can kind of see where it started with the little ones because they're mimicking. So that really pushed me to get educated a lot more about babies and toddlers. And I just actually got my IBCLC. So I'm a board certified lactation consultant, which really is a nice, well-rounded, perfect route for me to go to be able to help not just the babies, but then help the moms to be able to help them feed better once they do have tongue ties release. It's a really well pieced together training. And I talk about oral health every day, but I haven't touched a scaler in 3 years.
Oh, interesting. Yeah.
I talk to parents and educate parents and screen kids every day to see what kind of things that they're doing already that is going to impact their oral health later and their growth and development. So my mission is to really get dental offices trained to learn how to look for these things early.
That's amazing. Can we talk a little bit about that leap that you took? I mean, I feel like that's very scary to put down the scaler. Was it hard for you?
It is really hard. I did it really, really slow. So once I got trained in myofunctional therapy, I still practiced hygiene. I still, was doing a couple days doing hygiene and then a couple days doing myo until I kept adding more myo until I got to the point where, I wasn't doing hygiene that much anyway. And I made just as much, if not more, doing myofunctional therapy than I did doing hygiene. So that made it really easy. And my body loved it.
Oh my gosh. Yeah, I bet. I want to give the audience some tidbits here in a few minutes about kind of like our role as hygienists, seeing patients in our practice and maybe the referral source to a myofunctional therapist and things like that. But I want to maybe just talk, if you don't mind, a little bit more about the business model. For me, I mean, my poor listeners, like they are probably tired of me listening to me talking about business, but what is that, like, what does your daily schedule look like? How do you find clients? What is the referral, pipeline? Like, how is this feasible?
Good question. So I started out in a dental office. The doctor that I worked for was really gracious and would let me use his office when we didn't have patients. So I would just go in and see my patients there. It got to the point where I was through a lot of that patient population there, and I knew dentists were going to feel really uncomfortable referring to another dental office. So it was really go out and talk to other offices and say, well, just refer to me at this doctor. They were not comfortable with that. So at that point, I went and opened my own practice. So I found my own space. I actually shared space with an infant chiropractor. And that's kind of how the next part of my journey got started. But having my own independent practice, it gave me a lot of freedom. It is a little scary. And, I'll tell you, when you go for myofunctional classes, they don't really talk about business. I do teach a business class. My colleague and I, Susie Quaranta, who lives in Connecticut, probably talk every day. And especially when we were first getting our practices together, we were constantly, searching on Google and finding the right way to structure this and, what kind of business going to be, and there's just a lot that goes into it. So that's why we teach a class. You don't have to reinvent the wheel to figure this stuff out. It's all laid out really simply for you.
Well, if you'll do me a favor, if you will actually email us next time you have that business class going on, we will be happy to push it, on our social media as well, because I think that is, amazing. Dentists complain that they don't get it in dental school, right? Hygienists complain that we don't get it in hygiene school. Apparently it didn't happen in the myofunctional therapy courses to an extent that makes it feasible, like a realistic thing. So,
or to make you feel comfortable enough to make that jump.
Yeah, absolutely. Okay, so do you mind talking about kind of the roles that we do have as hygienists and the things that we should be looking at, screening for, all of that?
Yeah, so I have another colleague, her name's Kat Franklin-Salter, and she came up with a really cool thing for any hygienist to remember to screen for myofunctional issues that they're seeing their patients for. So it's a really quick, easy acronym. It's called SPOT. So SPOT stands for, the first S is for speech. Every time you have a patient that walks into your office, you're talking to them. So you can hear if they have speech impediments. Sometimes if they have a hard time pronouncing their R's or their S's, they could have a tongue tie. That's a big contributor to that. So that would be one kind of red flag for you to be looking for. The P in SPOTS is for posture. So posture means, are your patients able to stand upright, or are they slouching and leaning forward and having forward head posture, where all of that, their body posture translates into their head and neck posture, which translates into jaw posture, can cause jaw issues and pain, which, how many of us see that all the time? All connected. The next thing in SPOTS is the O, and that stands for occlusion, which we're checking that anyway. So that's going to be a really easy box to check. You're going to be checking to see if patients have cross bites or open bites. Those, again, are really big indicators that they're having issues with myofunctional problems in their mouth, with tongue thrusting or not resting their tongue up in their palate. So they really haven't been able to grow the right way. So that's, again, one you're going to be looking at anyway. The T stands for TOTS, which is tethered oral tissue. So when you're in your patient's mouth, you can really easily look for lip ties, tongue ties, cheek ties. They all have implications. We see patients with a lot of gum recession sometimes. That usually stems from cheek ties. It's tissue pulling it down and away from the tooth. So that's an easy one. The last one, the last S in spots, is for swallow. So if you have a patient bite together and swallow, you should not see their tongue come forward between their teeth. And if you do, that means they're thrusting. And if they're thrusting and not resting their tongue in the proper place, that can contribute to teeth moving, orthodontic relapse, again, TMJ issues, sleep issues, all the things that we're supposed to be screening our patients for anyway. We just maybe don't know how to do that.
Now, do you feel like this is the everyday hygienist is going to be seeing young children, or do you feel like this is something that we would be talking to our doctors and dental teams about?
I feel like for that spots protocol, you could really look at any patient for all those things. I feel like when it comes to the younger population, you're probably going to be seeing different things. You're going to be seeing kids walking in with open mouth posture, breathing through their mouth. And we know that causes dry mouth. It's going to cause cavities. We see kids walking in who are older kids who don't really need a pacifier that are walking around with pacifiers in their mouth. Yeah. That totally changes how their growth and development track is going to go. So it's not just how their mouth forms and grows, it's how then their nasal cavity forms and grows and how their jaws form and grow. And it's this domino effect that just continues to affect these kids, where I really think if we could catch all this stuff earlier and we start seeing kids from birth to 3, that's going to make a difference in life.
Do you feel that, parents, as we're having conversations with parents and children, if we spot something like, a tie or something like that, that they're hesitant to have the child go through something that's a little bit traumatic for them as we release those ties?
I think it really depends on the age and, what kind of things you see going on. We see patients, I gave up my private practice a couple of years ago, and I'm actually back in a dental office. My therapy, working with a doctor here that does our tongue tie releases. A big thing that we see is just educating the parents. Enough of us professionals don't even understand the whole world about tongue ties and all the implications.
Yeah.
So we have so many parents coming and they kind of have something in their gut that they feel like something isn't right, but they don't know what it is. So we have kids that come in that aren't eating, which means they're not gaining weight, which means they're not growing. Those are the kids where, you have to weigh out the risks and the benefit. Is it a traumatic procedure? Yes. It lasts a matter of 2 minutes though, and then they're done.
Right.
We've had 16-month-old kids come in here that should be eating all kinds of things at that age, and they're still on a bottle and they refuse to eat anything. Those kids are in a lot of trouble because they're not learning the skills they need to learn to chew. Chewing is going to grow their jaws. If they're not doing that, they're not growing properly. So not gaining weight. And that's a huge problem for these kids.
Yeah. Now, are there, for you personally, organizations or companies or, I guess, specific literature, pamphlets that you like to use to educate the patients of these parents?
So I make up my own. We have a whole program here in our office. It's called Mini Sprouts, and it is a milestone program where parents can come in from the time the kids are born until the kids are 3 and they're ready to go into their first dental clinic. So we see these kids for their milestone visits just like they're seen for their pediatric visit.
Right.
So the pediatrician, they check their length and their weight and their growth. That's great. When they come here, we look in their mouth and we're checking for proper oral growth and proper oral function, because that needs to be addressed too, and nobody's looking at that.
I love that. I love that a lot, actually. Do you mind, can we go over what does an appointment look like for you, maybe versus like what like the everyday clinician is currently doing?
Okay, so we see patients for all kinds of appointments, and I have a separate column that I run. So I see all kinds of different patients. Sometimes they'll come in for a consultation where they think they need a frenectomy, but they're not really sure. So we see infants, children, and adults, and I will go through their whole intake with them and get all of their symptoms. And then I sit with them and explain to them how the symptoms are correlated if they have a tongue tie. Why does that sore jaw correlate to a tongue tie? It's such a far reach for some people to understand that, but they're absolutely connected. That's where the breastfeeding really comes in. There's a lot of moms that breastfeed these days, and they're not really being heard by the doctor. So when they come in, their babies are clicking and leaking milk out of the sides of their mouth, and they're really sore. I'm able to connect all those pieces for them so they understand that it's nothing that they're doing wrong. It's just that because of this tongue tie, their baby isn't able to function properly. So the consults are a lot of education and really explaining the why and getting people comfortable with the concept of needing a release if that's what they need.
I really wish that we could do consultations just for perio too, right? Like that kind of in-depth conversation like you're talking about is amazing, but I feel like we're always so, on a time frame, and I love that you guys are taking the time to do that.
Yeah, we definitely take our time because parents have to feel comfortable before we do anything. An adult, they need to understand what they're getting into. I mean, it's still a procedure. It's an easier procedure, but it's still a procedure. So everything comes with risks, but it comes with really great benefits too.
Can you think of any of your success stories, things that you're really proud that you've been able to accomplish in your time?
I'm really proud when I have a mom come in that nobody is listening to her. She is, trying to find her answers to her questions about her kids on Google and Facebook. And asking people that don't have the experience that we as dental professionals know, but she can't find anyone to answer her questions. So we've had many moms come in who, after we've been through therapy with their kids and done a release on the kids, they'll come back for their post-op appointments. Their kids are eating. They're not in pain anymore. They're talking. I mean, we have success stories every week, and that's really rewarding to be able to help these kids and not wait. That's what dental is known for. Dental hygienists are preventive specialists. Like, this is what we do.
Yeah. All right. So I know you guys have, courses and things that you are, hoping that, every hygienist is going to take. So where can they find the information to learn more about what you do?
Sure. So if you're a myofunctional therapist and you feel like you need more training for myofunctional therapy, you can find our courses at levelupmyo.com. And if you feel like you're a dental hygienist who wants something different and you want to dip your toe into seeing kids from birth to 3, we have an entire program put together to help you implement that in your office. And you can find that at minisprouts.com.
I love it. Well, thank you so much for being on. I really appreciate it.
Of course. Thank you so much for having me.
You bet. Have a good day.
You too.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.